Hi, good evening. My name is Anatoly Doroteo. I'm a registered nurse at the University of San Francisco, clinical nurse there. I'm doing my assessment course for this semester, and part of this course, I need to assess the lungs, the heart, and the peripheral vascular system. So I have a patient down here. His name is Kenny. So Kenny, today we're gonna do an assessment on your lungs, heart, and peripheral vascular system. This will going to require you an exposure of your upper body. Part of it also, there's going to be a little bit of palpation of your anterior chest and at your back. Um, and we're going to use also a stethoscope to be able to listen to your breath sounds. Is that going to be okay for you?
Yes.
How are you?
Fine.
Have you had any history of smoking?
No.
Okay. So the first thing you want to do for the assessment of the lungs is to inspect. You want to inspect the chest cavity. You want to see if there's any retractions. You want to also inspect the rate or the breathing of the patient. Um, as of now, it seems that the patient doesn't have any respiratory distress. After that, we're going to move on to auscultation of the lungs. Uh, when you're doing auscultation of the lungs, you want to use a diaphragm. And by doing that, you want to do the sequence of listen to the lungs laterally in order for you to be able to listen to your both of the lung fields of the patient. So can you, as I touch down the stethoscope, I want you to inhale and exhale for me, okay? So inhale, exhale, 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 inhale, exhale. One deep breath for me. Inhale, exhale, inhale, exhale. So the breath sounds of the patient is clear, so you don't usually hear any wheezing or roncal or any abnormalities of the breath sounds. That concludes for the assessment of the lungs. We're going to move on to the assessment of the cardiovascular system. So assessment of the cardiovascular system, you want to go and do like an inspection first, inspection of the chest wall. Also, you want to do inspection of any pulsation of the neck, which actually you'll be able to like palpate and assess the carotid artery, which is located on the jugular vein. I usually do like 2 or 3 fingers so I could be able to like assess its end. So it's there. So it's palpable. The next one you're gonna do for the inspection, for the assessment of the heart is palpations. You want to palpate the uh, point of maximal impulse, which is going to be the apex of the heart, which is located at the 45th intercostal space. So my hands are going to be a little bit cold. So we're doing that. You want to see 1, 2, 3, 4, 5. Mid-clavicular. So actually, you want to be able to um, feel the lub dub. And then you're going to proceed on hearing or listening to the heart sounds. So you want to use the diaphragm first in pulmonic area, because in pulmonic and aortic area, which is a high pitch sounds, it's best to use the diaphragm. So um, deep breath for me, inhale. So you want to check the rhythm, the S1. Usually the aortic area is the initial cycle of the cardiovascular system. You want to move on to the pulmonic area. Deep breath for me. The P2 area. The herbs point. Sorry. And the apex of the heart. And then you're going to switch on to the bell on the area of tricuspid and mitral area because this is usually the low pitch sound. Um, the bell is the best um, tool or part of the stethoscope for you to be able to hear that. So we'll do the mitral area. And the base or the apex of the heart. So usually the normal heart rate ranges from 60 to 100 beats per minute. So as I'm calculating heart rate of Kenny, it ranges from 66 to 70 beats per minute. And that concludes the assessment of the cardiovascular system. We wanna proceed to the peripheral vascular system. So you wanna inspect any. Can you show me your fingers? Can you? So you wanna see, you know, his fingers of any cyanosis because that usually indicates for what? For circulation. You want to check for capillary refill is usually like what? Less than 2 to 3 seconds and goes back to its normal color. You want to check for the pulses, which is the brachial artery. The radial. Are you okay? Of course, you're gonna do both of the sides. And then you wanna inspect also the popliteal pulse. So what I usually do is that I grab two of the hands. It's much easier for me to look and find the popliteal pulse. It's very important for you to be able to assess and look for pulses in the lower extremities area because that will gonna indicate the circulation of the patient peripherally. There you go. And then dorsalis pedis. Okay. And the posterior tibial. Okay. While doing that, you want to assess also for any edema of the patient because edema indicates fluid retention of some parts of the body. That means if there's an edema, there's going to be a poor circulation of the lower extremities. As of now, um, as I can see, Ken doesn't have any edema, or pretty much he's in unhealthy state. Well, that concludes the assessment of the lungs, heart, and peripheral vascular system. I hope you'll be able to learn something. Have a good night. Thanks.